Sequentini, and I am in a group with Sarah Miller and Emma Visser, and today we're going to be talking about sinusitis, which is also referred as a sinus infection. So for the overview, it is a short-term inflammation of the sinus, which is acute sinusitis. There's also chronic, but I am going to be focusing on acute. This occurs when the spaces inside the sinuses become swollen and inflamed, and the sinuses consist of 4 paired cavities in the head, and the sinuses make thin mucuses that drains out of the channels of the nose, cleaning the nose, and these sinuses are typically filled with air, and sinuses become blocked by fluid and swell from irritation. So when this happens, they become infected. And also the sinuses are also connected by channels. Now causes is the common cold, basically the flu, which is a viral infection. Then your allergies, deviated septum, nasal polyps, bacterial infection, and fungus. And for the nasal polyps, they're just growths that hang inside the nose. Or of like the sinus cavities. And your symptoms include thick yellow or greenish discharge from the nose, a nasal blockage which makes it difficult to breathe through your nose, reduced sense of smell and taste, pain, tenderness, swelling, and pressure around the eyes, cheeks, nose, or forehead that worsens when bending over. And other signs for symptoms can include aching in the teeth, coughing, bad breath, fatigue, and fever. And for the diagnosis, it's usually diagnosed by discussing all of your symptoms and medical history and like the assessment. So right away, a doctor can be able to tell like, hey, you have a sinus infection. But if not, they also do a physical exam, which they just look at your ears, your nose, and your throat to check for any like blockage, swelling, and drainage. They can also do an allergy test because that's also a symptom, and this will determine like what allergies might have caused your sinus infection. And for treatment, antibiotics, which are helpful for bacterial infections, so only like the bacteria and the fungus, but they're not really helpful for the common cold or other causes. You can also do a nasal spray, which is like a nasal steroid, which helps to reduce congestion, pain relievers like ibuprofen, saline nasal irrigation, which cleans the nasal passage and makes breathing through the nose not as difficult. And you can do home remedies like that are shown in the picture, and it includes like getting extra rest, drinking more fluids, placing a warm towel over your nose to relieve pressure. And prognosis and follow-up, most cases usually resolve within a week to 10 days. It could potentially last up to 3 or 4 weeks. And if it does, you should contact your doctor right away afterwards, because if it lasts up to 12 weeks, then it is considered chronic, and those have more symptoms. It's caused by more things, and some of the treatment options for that include surgery, which it's better if it's treated early, so that way you don't have to do that. And you should not use over-the-counter medicine, nose sprays longer than 3 days unless your healthcare provider says you should, and just make sure you follow the treatment plans. And so prevention, wash your hands well, before and after eating and after using the bathroom, or just touching your stuff around the house that could potentially be dirty. Don't touch your face at all. Don't smoke, and avoid secondhand smoking because this can cause mucus to clog up in the nose or sinus. Stay away from things that you're allergic to. Receive vaccines such as the flu. Avoid sick people. Use a clean humidifier to moisten the air at home. And keeping your body and your immune system in good shape by eating well, lots of vegetables and fruits, and staying hydrated. And these are the sources that I use if you wanted to look at them.